Hello, Freedom Village residents. I'm John Bruner, your Executive Director. Welcome to a special program with our Medical Director, Dr. Andrew Ulichney. Welcome, Dr. Ulichney.
Thank you for having me, John. It's a pleasure. I've done a few television spots. It's probably been about 5 years, and I've been told I'm more designed for radio than TV. So that's what stopped the show.
Oh, well, you know, it's an important time here at Freedom Village, and we're so fortunate to have such skilled nurses and affiliations with physicians like Dr. Ulichney. And I thought it would be really important that Dr. Ulichney sit down with me and go over some questions and answers that I thought might be helpful to you as residents here at Freedom Village as to how we're preparing for the COVID-19 pandemic and what things you can do to be safe. So let me start with my first question, Dr. Ulichney. So what can the residents of Freedom Village do to stay safe during this pandemic?
Okay, that's a great question. I'm sure all of you are seeing multiple news outlets and our politicians at every level addressing this question. The most important thing, Freedom Village and LCS has been ahead of the curve in the nation, and they have put facilities in lockdown, restricted visitors, and LCS, we do not have masks on currently, but had this not been a filming opportunity, I would be in a mask because I could run into one of the residents here. So staying at home is important. You have everything you need here. You have a phenomenal facility. You made a great investment with having people be able to do things like bring you meals and things like that. So the most important thing is social distancing, restricting travel. Those of you who've talked to family and friends outside the community, about 75% of the country has a degree of social isolation, distancing, restricted travel, and that's the most important thing that you can do. When you see people wearing masks in this community, we're following CDC guidelines because it's actually going to protect the patient or the resident rather than me. So if I am wearing a mask, I'm not trying to prevent myself from getting an infection. What I'm trying to prevent is myself from spreading germs, specifically a virus named COVID-19, to people, because we think over 10% of people who are infected are in fact asymptomatic. So there's a lot of asymptomatic carriage, and I may have no symptoms whatsoever, but if you encounter someone who does have some risk factors, some health issues, it can turn from asymptomatic to a critical medical situation in short order. So that's the most important thing. Wash your hands a lot, try not to touch your face. Those are also things that I would recommend to anyone all the time, but especially at this time.
Great suggestions. Thank you, Dr. Ulichney. One question that residents have posed to me a few times is, what kind of supplies or over-the-counter medications should you have in your condo in the event you do get sick?
So it's always a good idea to have at least a month's supply of your medication. Many of your doctors give you 90-day supplies. During this time, I would suggest that you reach out to your healthcare providers and get at least, make sure that you have 30 days on hand. Over-the-counter medications such as Tylenol are always a good idea for mild pain and fever. I'm frequently asked about ibuprofen, Motrin, Aleve, Advil, naproxen, and aspirin, and their role in the COVID-19 viral treatment. There were studies that showed potential harm from those medications. I will tell you this virus, the pandemic, is causing changes in healthcare at a rapid pace. The bottom line is right now we just do not know what the effect, if any, that any of the non-steroidal anti-inflammatories like ibuprofen or naproxen would have. the safest thing to do for anyone, but specifically people over age 65, is to use Tylenol.
Great information. So let's say I'm a resident here and I'm starting to feel sick. What's the first thing that I should do?
First thing you should do is call your primary care doctor, who knows you best. Go over the symptoms. All of the offices that I've encountered have, if they're not open to seeing patients, because many patients are sheltering at home, so the number of people who come into my office has decreased dramatically. On a typical day, I would see 20 patients in the office. I may see 2 or 3 now if I have an office day, but someone in my office is always available to take phone calls and to walk you through the decision making, because it is a little confusing when you see something like a viral syndrome, fever, chills, body aches, runny nose, cough, nausea, vomiting, diarrhea. Those all can be signs of COVID-19, but most likely it's signs of other things. And with all the beautiful trees in bloom and the flowers popping up, we also are encountering the time of year when I see seasonal allergies. So if every year you get allergies at this time, I suffer from them. I've been taking my Claritin religiously because I don't want any confusion as to what symptoms I'm feeling.
How important is it if your physician recommends you essentially self-quarantine and stay in your condo? How important is it that you follow those recommendations?
It's critically important if you've been instructed by a healthcare provider to self-quarantine. Absolutely.
Important. So you're probably seeing what the local hospitals are doing. How are the local hospitals prepared for the potential influx of COVID patients?
I'm happy to report that Mainline Health, we're extremely well informed. We have multiple emails that keep us up to date. I've been at multiple meetings, some even today. We're doing a lot of our meetings virtually, so on the computer you may have 60 people in 40 different locations. The meetings are telling us that we have seen an increased activity, just like you're seeing on the local news. Thankfully, we're not in a very high density area like New York, so the increased number of patients we have seen, we have been able to absorb into our existing healthcare system. We have adequate numbers of PPE. We have an adequate number of ventilators right now. So I would say we're in a good situation, and we are anxious, like the rest of the country, for the coming weeks, because that's going to be the critical piece, and that's why self-isolation, staying at home, avoiding unnecessary interactions, and travel are so critical.
Great, thank you, Dr. Ulichney. One of the things that Freedom Village has convened is a COVID-19 task force. As in any emergency, it's so critical we have a plan. Freedom Village has an emergency plan for many, many different scenarios: fire, hurricanes, snowstorms, power outages. This was an unusual and unlikely emergency that we hadn't fleshed out as greatly as we'd like to. So it's something that we've convened this task force to do, to flesh out more detailed plans of, just like the presidential task force is evolving their plans on a daily basis. So I'm happy to report that Dr. Ulichney has been participating in these task force meetings. We're looking at a variety of things, from staffing to managing a plan for sick patients if we were to have any, which I do want to report, by the way. We still have no reported cases of COVID-19 here at Freedom Village, whether staff or residents, but just having plans, implementing plans as we've done with social isolation, social distancing, I should say, restricting many of the social activities that we have. All these are part of our plan. So I just wanted to hear your perspective, Dr. Ulichney, how important it is to have a plan, have a task force that addresses these things.
Freedom Village and the parent company LCS is leading the industry in what we're doing. Not infrequently, John, what you guys are and ladies have done here is then getting implemented in other facilities 2 days or a week later. So I must commend Freedom Village and your management team for what you've done. We have convened surge planning. Again, this has been done on the fly because I was looking at emails today, and about 3 weeks ago, the emails mentioned nothing about COVID-19, and then it seems like that's all I see on my emails starting about 3 weeks ago. And it's evolving. The CDC recommendations are clearly changing, if not daily, at least weekly. The Department of Health has made major changes. We got a 26-page document from the Center for Medicare and Medicaid yesterday that I've told people that I've been in practice 22 years. They've changed the paradigm of practice overnight, and things that we never would have done yesterday are now covered under CMS and sanctioned that we make a change in practice to accommodate this national healthcare crisis.
Well, it's quite a unprecedented event that's happening to our country, but I'm so fortunate to have you, Dr. Ulichney, as part of our task force and have you on our team. I really do appreciate that.
I'm happy to be here, and I'm plan on going nowhere fast.
Great. Before we leave, though, I wanted to ask you one last question. We talked a little bit about documentation and such that you should really take a look at as you go through something like this. What types of things should residents make sure they've taken a look over prior to this?
Okay, so that question has come up, and it's not infrequent to the analogy of we hear there's a hurricane off the coast, and then we look at our homeowners policy. This national healthcare crisis has had many of us look at our plans, not just at Freedom Village, but our own individual plans. And I'll give you the example of my folks. My dad and mom, phenomenal people. They did their advanced care planning, estate planning in 1994. My dad passed away in 2016, and no alterations to their documents occurred. There were some changes along the way, and I will tell you in the course of my career, not germane to my parents' situation, but spouses have changed. Powers of attorney, not infrequently will have a health issue or die before the patient that I'm looking to speak to a power of attorney, and then I call that number and find out that they're no longer able to serve as or unavailable altogether as power of attorney. So I would say look at who your power of attorney is, make sure it is who you want, make sure your power of attorney knows that you've asked them to be powers of attorney. I've called people who were surprised to know that they were the power of attorney of, say, their uncle. I would also say in the course of my 22 years, I've had patients where ex-spouses have been powers of attorney. I would look at your advance directive, wills. If you are firm in your desire for a DNR, your doctors, your primary care doctors can give you a PULSE, a physician order of life-sustaining treatment. I've filled out this week, a number of patients have requested out-of-hospital DNR forms. So forms like that, I would say, make sure that they're up to what you want.
Good suggestion, Dr. Ulichney. Well, thank you so much for joining us. Great information for all our residents to consider, and I appreciate you coming today.
Thanks for having me, and I will hopefully talk about more interesting topics like gardening in May.
Thanks again, Dr. Ulichney.